Welcome to the Shatkin F.I.R.S.T Monday Morning Minute. Good morning and welcome to the Monday Morning Minute. We're very fortunate this morning. With me, you probably all know him, I'm sure, is Dr. Gordon Christensen from Provo, Utah. Gordon, it's a pleasure to have you with me this morning.
Delighted to be with you.
Thank you very much, sir. So, you're in Buffalo this weekend lecturing on the one-piece mini and mono dental implants.
Right.
Can you give us an idea where we stand in the summer of 2024? What could you say about mini dental implants?
Well, in 1997, the Federal Food and Drug Administration cleared small diameter implants for long-term use. And as most of you know, they're 1.8 to 2.9 millimeters in diameter, depending on the company. And they were slowly integrated. I got right on it because I could see many patients who did not have enough bone for standard diameter implants, or you had to cut off 5 millimeters to find width enough to put them in. And little by little, we proved in Clinical Research Associates that it was working. And little by little, oral surgeons still were not believing it, periodontists were not believing it, but they weren't doing any. They were just talking about it. And because of, obviously, some financial reasons, they were afraid that maybe their clients would go to general dentists instead of them. When in fact, when a general dentist starts to do implants, they find the cases they don't want to do, and they refer more. That's been proven. Right. So now, where are we? We have done a lot of research in what we now call Clinicians Report Foundation. We're a true foundation, non-tax-paying foundation. We don't take money from the government or from companies. And bottom line is they are now serving better than the standard diameter implants, the 3 millimeters and up. We're not seeing as much periimplantitis, almost none in cases I've done that have gone 20, 25 years. And we've got both big and little implants in because the large ones have a jiggling head on, which is the abutment and the crown, and that squishes out juices all around right at the bone level. The bigger companies are now starting to move the intersection up above the bone and above the gingiva even. Right. So mini implants was the key to understanding that. And mini implants are now accepted. And they're actually, in many ways, serving better than the larger implants.
And that is so, I learned a lot from your lecture this morning, is, this negative connotation that goes with them. In certain, I mean, it shouldn't at all, but it does. And you were talking a little bit about TADs, and that was very interesting. That people think, okay, well, mini implants are a lot like TADs, but it's so drastically different.
Very different.
It's so different, and it was great for you to bring that point up.
Thank you.
Yeah,
that was an impediment in the understanding of small diameter implants. Even with the TADs, you have to tweak them occasionally, because they start to integrate. A standard implant will take a few months to 11 months to integrate.
Right.
And if you leave it in too long, the TAD will even start to integrate.
I guess if you keep that blood supply healthy and the periosteum intact,
that's exactly
and all,
right.
Really, these implants work really well.
Very
and Dr.
true.
Shatkin, he tells me all the time how many successful cases he's been having.
Good.
And it's a great thing.
Oh, yeah.
And we're trying to spread the word and teach as many. I know you do as well.
Yeah.
So.
Yeah, well, it saves a lot of bone, frankly, because with the standard all-in-4 technique that is now, a little too prominent, in my opinion, they're taking off 5 millimeters of bone, 4 millimeters of bone, the same on the lower, and when that bone is gone, when, not if, an implant fails, they got 20,000 to, we have a couple of patients we're redoing that somebody else did at 60,000. So it's time to look very seriously at the conservative orientation.
Absolutely, I couldn't agree more. I mean, it used to be able to buy a house for that much. I mean,
my first house was $27,000.
There you go.
That'd probably be $100,000 now.
Right. It's amazing. Yeah. But yeah, that's a great point too. But the less periimplantitis, the not as many visits to the dentist. You can you can really put these mini implants in and mono implants in and be able to either load them immediately or load them in a few months down the road. And it's less expensive. There less visits to the dental office. It's just there's so many positive things about it. So
and it's so simple to do once they learn the anatomy well.
Yeah. And we really appreciate you being here lecturing with us today.
My pleasure.
It's a joy.
Look at them, you guys who are watching this, and
There you go.
if it turns you on, go for it.
You got it from the guru right there. Thanks for joining us this morning on the Monday Morning Minute. We look forward to seeing you next week, and we hope you have a great week placing small diameter and monodental implants.